Hi, everybody. This is John Osborne, the Director of Cardiology for the Low T Centers in Southlake, Texas. And I'm here to talk about something very important. We're going to talk about the coronavirus pandemic that's occurring right now. We're going to talk about the history of that. And I'm here with Guy of Wise Guy Talks, and all this will be appearing on your Southlake. So, obviously, people are really, I think, engaged, concerned, worried, seeing what's happening in China and other countries as well. We'll kind of update you on current statistics here in a second. But before we get into that, what I want to talk about is a little bit of history, because I think it's very, very interesting. So many of you probably have heard about, particularly with this pandemic breaking out in China, of 100 years ago, almost exactly 100 years ago, it was 1918 to 1919, of the outbreak of what was then called the Spanish flu. So this outbreak that occurred 100 years ago, right around the end of World War I, was ultimately responsible for the deaths of about 50 million people worldwide. It literally spread throughout the world. And also appreciate this is before there was airplanes, jet transportation, all of that. And you wonder, geez, how did this Spanish flu travel throughout the world? Well, it was very highly infectious, and at the same time, we had World War I going on, and because of that, we had lots of troops and people emigrating all over the world as well. So all of that facilitated the spread of this disease as well. The disease that was seen in that era, the Spanish flu, was an influenza. That is a specific kind of a virus. Obviously, these days, everybody should be getting their flu shot, by the way. So everybody above 6 months old should be getting their flu shot. And you should. And I don't care if you feel that it gives you the flu. It will either help prevent the flu or make it less bad for you. And we'll talk about mortality right now from the outbreak of the pandemic in China. But we'll also compare that to mortality from influenza right now in the U.S. Let me jump into it. So if you look at mortality rates right now from the coronavirus in China with reported cases and reported deaths, it looks like the rate of death is about 2% of the people getting the virus. If you look at the rate of mortality from influenza in the US, it's about 0.1%, so much less. However, influenza is extremely common everywhere in the world, and certainly in the US. So what will happen, and we're already at about 17,000 deaths from influenza in the US. So 17,000 people in the US have died from influenza for which we have a vaccination, whereas we have about 600 people at this point who've died from the coronavirus outbreak in China. So put that in perspective. In fact, already in Dallas County, as an example, looking at teenagers, right, 18 or below, we already have 17 teenagers in Dallas County alone who've died of influenza with the current outbreak, as we have every year here in the United States. So the problem is a lot of this is your radar, right? We hear all this stuff about coronavirus, we get all excited, but in reality, we have a huge outbreak, as we do every year, of very deadly flu. So I think that's important to remember as well. And also a little interesting medical tidbit. Where does the term influenza come from? It actually comes from a song, sort of a song from well over 100 years ago, before we knew about viruses and bacteria and all that. And there was a song that would basically say, knowing no idea what caused influenza, they thought it was due to night air, so you'd close the windows at night. And if you didn't, the song would go influenza, and hence the term influenza. So that's where the term influenza comes from, by the way. And thanks to Guy for that tidbit as well. So it is important to understand influenza is one family of viruses. Coronaviruses is a different family of viruses. And that's important both for spread as well as the opportunities to create vaccines. The influenza virus does change every year, but it changes to a fairly limited degree. Unfortunately, coronaviruses, a whole different family of viruses, which is what's causing the outbreak in China right now, is a different family of viruses, and they're an incredible array of coronaviruses. So the problem with creating a vaccine is that we need to create a vaccine for a specific form of the coronavirus, of which there are multitudes, whereas with influenza viruses, the variety is much more limited. So it's easier to create a vaccine for the influenza that we have every year and worldwide for influenza than it is to make a vaccine against one of the specific forms of coronaviruses. Not impossible, but much, much more difficult. That's why, and typically your coronaviruses are the viruses, amongst other families, adenoviruses, echoviruses, by the way, for wonks out there, are viruses that cause your typical cold. It's the cough, upper respiratory tract infection, cough, runny nose, all that stuff. So these are the same viruses that typically cause the cold. The problem is that this particular form of the virus that looks like it's actually being tracked back to bats. Bats actually are the reservoirs for coronavirus, and they harbor lots of these coronaviruses, probably communicated from bats in a wet market in Wuhan, China, in the province of Hubei, to humans, and then, of course, dramatically expanded. In fact, just to put this in perspective, so here we are in the beginning of February, the first cases of coronaviruses reported in Wuhan, China, were not until December 31st of 2019. So a little over a month ago. And in that period of time, as far as reported cases, we now have over 36,000 reported cases and roughly about 600 deaths from this virus, or about a 2% mortality rate. So it certainly is a concerning virus. So having said that, the questions that I hear all the time, do I need to worry about it in the U.S.? Well, so far in the U.S., due to obviously a variety of contamination and quarantine procedures and certainly concerns about this spreading into the U.S., there have been about 12 cases reported in the U.S., no fatalities, fortunately. Many of those people have already have improved, but there have been a handful of cases reported in the U.S. Worldwide, outside of China, there's about 270 cases that have been reported, with 2 deaths, one in Singapore and one in Hong Kong. So interestingly, the mortality rate, at least the reported cases outside of China, appears to be much less, which I think is to some degree reassuring. Other things that I have questions about all the time, what is the role of masks? Obviously, if you look at pictures from China, you see everybody in masks. What's the value? In reality, there's 2 kinds of masks. There's the typical surgical masks, the stuff you see docs wearing around the hospital and things like that. And they're really not terribly effective. They don't fit well. They're not really sealed. They probably make you feel psychologically better, but probably not really terribly effective to prevent the transmission of the coronavirus or flu or other viruses. The masks that may have value are special masks. And the surgical masks are pennies a piece at most, less than a dime. The masks that may have value are really medical masks called N95 masks. These exclude 95% of all the particles that are below 0.3 microns, so very, very small. And they're very, very close fitting. They need to actually be fitted to the face carefully. They're about $1 a piece. So they may have value, but again, it's probably somewhat limited. In fact, I always like to say probably the greatest value of masks is really for the people who are infected to help prevent them from putting out all the aerosols and particles and all the stuff by which this is transmitted. So it may be better to have people who already have coronavirus or influenza or those things wearing masks than everybody else wearing them. So again, probably marginal benefit, certainly with the regular masks, and really only with the more expensive N95 masks may be valuable. And the N95 masks are really designed for bacteria, which are an order of magnitude 10 times larger than viruses, and to prevent pneumonia, tuberculosis, things like that. That's really where their value is. Because the viruses, the particle size is about 0.3 millimeters, that is the threshold with what these masks keep out if you wear the N95 mask, but the viruses are 0.1 micron, so they're much, much smaller. So having said that, wear a mask if you like, but I wouldn't take that to the bank as far as protection. The one thing that is, again and again, highly effective at preventing transmission is good old hand washing. Wash your hands multiple days. I do. My hands get dry at the end of the day from all that, so make sure you use lotion as well. But hand washing is critical for any kind of prevention of disease transmission, whether it's influenza or coronavirus. So hand washing again is critical and key. So question comes up: what is appropriate hand washing? So hand washing really should be at least 30 seconds. Obviously, use soap, hot water, and if you really want to be appropriate, the best thing to do is take that hand towel, use it to dry your hands, and then, because what's happened is all the people have been touching those handles, right? If it's not an electronic infrared faucet, if it does have handles and you need to turn it off, then take that towel that you just used and use the towel to turn off the handle, because otherwise you're going to pick up all the viruses that have been then implanted and are existing on that handle as well, unless again it's an infrared activated faucet. So at least 30 seconds, and then make sure you dry your hands well. And then you can also use the alcohol as well, the Purell type agents. But really, the biggest benefit of hand washing is literally hand washing. But it really needs to be for about 30 seconds to make sure it's effective. So the question I hear a lot about, okay, hand washing, very, very important. We talked about masks. Kind of masks sort of make sense. Why is hand washing so effective? Well, because our hands are everywhere, right? They're touching everything. They're grabbing onto door handles and everything else. And then what happens is, after we touch all these door handles and elevator buttons and things like that. In fact, Marriott did a study, not really widely published, that shows the dirtiest place where the most bacteria could be cultured in a Marriott hotel, and I'm sure it's any hotel, it's not Marriott alone, is actually on the elevator button. So you can imagine we're picking up droplets and viruses and bacteria all day long. So that's why washing the hands is critical, because then what happens is if they get on our hands, we're constantly touching our face and rubbing our eyes and all that kind of stuff. And of course, that obviously will then get into facilitate the entry of these bacteria and these viruses to cause infection. So that's why hand washing is really, really critical for disease control under any circumstance for any infectious disease. So the question that okay, so we touch the elevator button, we pick up a virus. How long does a virus actually stay alive and is viable that it can still infect us? Now, the good news is these viruses usually require a water environment. Typically, when they dry out, that tends to make them less virulent, less likely to cause infection. So they don't have a long, long life outside of us or an animal or a bat or whoever is transmitting it. So it really requires generally transmission from a bat or an animal or another, as we call it, vector, or a person from one person to the other. And generally that's in a droplet form, all the little tiny droplets we make when we talk and cough and everything else. So the lifespan of a virus just sitting by itself is actually pretty short, which is good, but still, nonetheless, hand washing becomes key to help stopping the cycle of infection. Okay, so one final question before we're done here. The question is, if I cough or someone coughs or they have corona, or I'm worried they have corona, what distance do those droplets, what's the range of effect? 6 feet. 6 feet is the answer. So yeah, so kind of a little impressive, a little scary. So 6 feet. So bring your tape measures. Make sure you're outside of 6 feet. No, that's fun. But 6 feet. So again, the point is that these droplets can really travel pretty far if you cough, sneeze, etc. And again, be smart, do the right things. Most importantly, hand washing. Wear a mask. If you wear a mask, it should probably be one of the more effective masks, the N95 mask, that again are much more expensive. And the other thing too, one thing I'll say about masks is not only if you wear the mask, you may or may not get protection. But the other thing is, you got to be careful when you take the mask off. What do you think is coated on the other side of that mask that's not against your face, right? It's all those droplets and particles and viruses. So you also have to be careful when you take the mask off. And by the way, the masks last about 8 hours. Okay. After that, they're worthless. So when you take that mask off, you also need to make sure that you're not sitting there getting all those viruses and particles off the outside of the mask. So again, once you take it off, be careful of that. And yet again, wash your hands. This is John Osborne from the Low T Center in Southlake with Guy from Wise Guy Talks on your Southlake and